What was chemotherapy like in early brain tumor treatment? Imagine stepping into a world where scientists were just beginning to understand how to fight cancer with chemicals. Early chemotherapy for brain tumors started around the mid-1900s, after chemotherapy was already being explored for other cancers. The challenge was that many drugs couldn't easily reach the brain because of a natural barrier called the blood-brain barrier. This barrier protects the brain from harmful substances, but also makes it hard for medicines to get in and treat tumors effectively. The first drugs used in cancer treatment, like nitrogen mustard, were discovered during World War II and showed promise against some cancers like lymphomas. But when it came to brain tumors, these drugs had limited success. They could damage the cancer cells but also caused significant side effects because they affected healthy tissue. Early treatments often involved drugs such as methotrexate and cyclophosphamide, which could interfere with the DNA of rapidly dividing cells. However, their ability to improve survival was modest, and side effects like nausea, hair loss, and immune suppression were common. During the 1950s and 1960s, doctors experimented with combining chemotherapy with surgery and radiation therapy. The goal was to find drugs that could damage the cancer's DNA, slowing or stopping its growth. Despite these efforts, outcomes were often disappointing. Many patients had low survival rates because the drugs couldn't reach high enough concentrations in the brain, and some tumors, like glioblastoma, are very aggressive. A breakthrough came in the early 2000s with the development of Temozolomide. This oral medication could cross the blood-brain barrier more effectively than earlier drugs. Clinical trials showed that adding temozolomide to surgery and radiation therapy significantly improved survival for patients with certain brain tumors. Before this, chemotherapy was not a standard part of brain tumor treatment because of limited evidence and concerns about toxicity. In summary, early chemotherapy for brain tumors was mostly experimental and faced many hurdles. The drugs used were originally developed for other cancers, but their effectiveness was limited by the body's natural defenses and the aggressive nature of brain tumors. Side effects were common and sometimes severe. Chemotherapy was mainly used alongside surgery and radiation, not as a standalone treatment. Over time, advances like temozolomide have made systemic treatment more effective and safer, helping improve outcomes for many patients. Today, treatment plans are personalized, combining different therapies to give the best chance of controlling the tumor while protecting brain health. Always remember, if you or someone you know is facing a brain tumor, consulting a medical professional is essential to understand the most current and appropriate options.